Good evening, Peter Goertz. I'm a psychiatrist. Panic attacks, are they an opportunity to improve our lives? And I'm not trying to make a joke here, but in my opinion, the short answer is yes. For instance, by potentially looking at the roots, psychological roots of those panic attacks. And today I actually saw 3 patients that I guess were contributing to me thinking about panic and anxiety. And they were from very different walks of life, very different ages and different situations, but there was something in common about them, and that was that they had severe anxiety, and at least 2 of them panic. So let's talk about aspects of this, and part of what I'm going to be getting to is what I think might at least sometimes be psychologically underlying panic and anxiety. And of course, if you look it up, you may see in books, panic or anxiety is due to certain issues in the brain with neurotransmitters, but I'm going to be focusing at least somewhat on the psychological or possible psychological underpinnings of anxiety and panic. So think of this example. You're a young woman, just married, and your mother-in-law comes into your kitchen and tells you, "You don't know how to cook. Let me show you how to do this." So I'm sure you're going to have some feelings about that. And those feelings, if you don't express them, don't acknowledge them, don't digest them, and maybe act on them in a way that feels satisfying to you, that can build up inside of you and potentially can become a pressure cooker. So that's the type of thing I'm going to be talking about. Anxiety and panic, especially panic, can be overwhelming and lead to physical signs, symptoms like palpitations, sweating, trembling, shortness of breath, chest pain, even feeling like people are going to die. So people feel like they're possibly having a heart attack or going to die and go to an emergency room. So another example, a patient I saw many years ago, a young lady, still a teenager actually, was having a lot of psychological stress and conflict with her mother. And she had not acknowledged and digested the emotions behind that stress. So she had, about a month before she began seeing me, she had begun having physical symptoms of anxiety, severe anxiety, panic attacks, and it went very well with that patient. Fortunately, it's not always that easy or not always that quick, but after 1 or 2 sessions, she started understanding where things might be coming from, started looking at her emotions, started thinking about her interactions with her mother, started thinking about how to stand up for herself, and the panic attacks resolved. So things can work out very well, even without medicine sometimes. So again, I'm talking about undigested, unresolved emotions, and if they remain unresolved for some time, that can create an internal pressure cooker. And that pressure cooker may potentially erupt then in psychological issues like panic attacks. So one thing that can help, of course, like I mentioned, is acknowledging your emotions, and also, if necessary, setting boundaries. That can help a lot. So if your mother-in-law comes into the kitchen, says you don't know how to cook, you can tell her in a strong way, but courteously. You don't want to curse or scream, but you can be even stronger if you say things in a courteous way. You can say to your mother-in-law courteously, I don't need your help. And that's it. So, and if the mother-in-law gets upset and she starts screaming, getting angry, that's probably a sign that you're doing the right thing for yourself. Other aspects of anxiety and panic, and that can be quite frequent in patients if they're on Xanax or a short-acting benzodiazepine. They can start getting anxious just from their medication wearing off. So not necessarily psychological issue underneath that, but just what we call rebound anxiety from the Xanax or other short-acting benzodiazepine wearing off. That can cause some withdrawal and then anxiety. Other aspects, of course, to consider with anxiety are drug or alcohol use, withdrawal, medications, medical conditions, but I'm not really going to be focusing on all that today. So if someone comes to an emergency room with a panic attack, what they may well do is give the person an injection of Ativan or an oral dose of Ativan, a short-acting, relatively short-acting benzodiazepine, and that can help the symptoms. But of course, that doesn't get to the root of things. So if they don't stand up for themselves, if they don't set boundaries, if they don't look at their emotions, if they don't acknowledge them, digest them, embrace them, that can lead to another problem down the road with anxiety and possibly panic. Psychotherapy can help a lot with all this. So that can help to embrace and digest emotions, set boundaries with people, and also look at your triggers. What can trigger anxiety? What can trigger panic? Medications can be helpful. They're often prescribed for anxiety and panic. So SSRIs, for example, benzodiazepines as needed, for example, for panic. And I think that's it for today. So bottom line, all of us, we want to try and acknowledge our emotions, be aware of them, first of all, acknowledge them, digest them, and then be able to act on them. So in that sense, again, anxiety, panic attacks can point us or actually push in our face, almost force us to deal with whatever underlying potential psychological issues there are. Thank you.